been slapped with a summons. She's facing 3 charges for illegally importing dogs Pistol and Boo against quarantine laws.
Agriculture Minister Barnaby Joyce has defended Australia's tough biosecurity laws.
A lot of things we're easy going about, but we're not easy going about biosecurity. We're deadly serious about it.
Until the coronavirus came along, the most recent Australian quarantine issue to attract attention, in fact global attention, was the fate of 2 small dogs smuggled into the country by American actors Johnny Depp and Amber Heard in 2015. Pistol and Boo, and therefore Depp and Heard, were in breach of Australia's Biosecurity Act, passed that same year as the first comprehensive overhaul of one of the nation's oldest laws, the Quarantine Act of 1908. The Department of Agriculture would oversee the plants and animals. The Health Minister would keep powers to deal with humans.
This is a very substantial piece of work and the culmination of over 100 years of experience. It is expected that human health provisions contained in the bill will be seldom used. However, it is important that legislative powers are available to manage serious communicable diseases should they occur.
Human quarantine has been a big issue going back to the days when visiting ships could bring infectious diseases into the colonies. Quarantine was in fact the only health power given to the new federation in 1901 and has been used to deal with threats ranging from smallpox to the ravages of the Spanish flu in 1919.
It's thought at least 50 million people died.
But the carve-up of responsibilities between the federal government and the states has always been problematic. Fast forward to the beginning of the COVID-19 pandemic last year.
Tonight, new drastic measures on coronavirus.
In March, with the decision to require all returning Australians and other travellers to quarantine for 14 days, a deal was struck between Scott Morrison and state and territory leaders. The states and territories are running hotel quarantine as part of their broader responsibility for public health, despite it being a federal role under the Constitution. The states agreed to run the quarantine system and fund most of it. You might find that surprising given the usual fights over money. But the states give a number of reasons why they were happy with this arrangement. They needed Canberra to use its Centrelink systems to distribute income support to casual workers who might be holding down multiple jobs and as a result be spreading the virus. There was also, quite frankly, a lack of confidence in Canberra's capacity to run the quarantine system. States point to the fact that one of the biggest crises was in the federally regulated aged care sector. Finally, it was not just international borders that had to be considered, but interstate ones. From the federal government's perspective, it has been saved a lot of money and been kept clear of any political fallout from systemic failures in hotel quarantine.
In all other states and territories, I think the experience has been quite different to Victoria, and that is a great shame in Victoria.
It's good that the states took their share of getting the job done, but ultimately it's the Prime Minister and the federal government who are constitutionally responsible for quarantine. And we've had outbreaks from quarantine in 4 separate states.
There have been a number of inquiries into the system, notably the Halton Review of hotel quarantine arrangements and the Senate inquiry into the response to COVID-19.
The hotel quarantine system is vulnerable to breaches, and these are hard to eliminate. It's also an expensive resource and comes at a high cost to individual, social and economic well-being.
The review found using hotels for quarantine was essentially the best option when it was set up. But it suggested a national quarantine facility be established and kept at the ready in the case of a sudden surge in incoming cases as travel takes off again. The federal government has been sending people brought back to Australia on repatriation flights to Howard Springs, a disused workers' camp in the Northern Territory that can handle 850 arrivals a fortnight. And it plans to send more to sites in Canberra and Tasmania. In an interim report last month, the Senate inquiry into the handling of the pandemic argued there remains a number of options that the Australian government could utilise, including expanding Commonwealth-funded quarantine facilities to help get stranded Australians home.
And why isn't the Commonwealth solving it, like opening quarantine facilities, running them, using the ADF?
As you understand, Chair, the Commonwealth obviously doesn't have a public health capacity. The ADF element is a point that, of course, has been raised. The ADF, all medical personnel in the ADF amounts to 935 staff. They are almost all deployed, supporting the states and territories already. So the real limiting factor on increasing quarantine capacity is the availability of trained medical professionals.
And this brings us to the biggest question for the quarantine system in the future. Who staffs it and who pays for it? Right now, the federal government's contribution in dollars and manpower comes from the deployment of 1,500 Defence Force members to the system. Quarantine is chewing up huge state police resources too. For example, there are 900 Victorian police officers working in that state system alone.
I don't think a shortage of doctors is the main pressure on quarantine. It involves security, it involves transport, and the strains we've seen on the quarantine system have come from just those points, security and transport. Now, they are things the Commonwealth has plenty of resources to assist with.
A new debate about whether to change the quarantine system, including using mining camps, was started last week by Queensland.
I'm going to put this forward as an option to the federal government. Howard Springs works very well in the Northern Territory, and there's no reason why we couldn't do something similar here in Queensland, or if not, around the country.
Another idea is to move quarantine hotels to regional areas.
We have about 5,000 people in our quarantine system at any one time and 3,500 staff. So it would be very challenging to find a regional area that could cope with that. But secondly, our public health officials have indicated that that would create further risks for us, particularly in transporting people on buses.
It all points to an interesting conversation at this week's National Cabinet meeting.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.